Thank you. Good afternoon, everyone. I'm Jason Glass, Commissioner of Education at the Kentucky Department of Education. We're delighted you could be with us this afternoon. We have an exciting agenda to cover with you. I think some items that are timely and that will be helpful to you as you work to navigate COVID and getting through the rest of this semester and a number of other things you have going on. I wanted to start with just briefly reviewing the agenda that we have coming up. So we've got Tony Cons-Tapman is going to do communications updates. We'll have Robin Kinney on to update you on the budget. I'll introduce to you Dr. Thomas Woods Tucker to talk a little bit about diversity, equity, and inclusion. We have Dr. White and Dr. Kavanaugh on to talk with us about quarantining procedures in schools and some changes that have happened with that. And then we'll finish up with questions and discussion. The first thing that I wanted to touch base on was just sort of debriefing election for just a moment. At the state level, we saw Republicans in the state legislature expand their majorities in both chambers. So not a lot of changes when it comes to the policy landscape here in Kentucky, and we'll be reaching out to work with newly elected legislators and congratulating those that have won re-election. And we'll see what changes happen, if any, in terms of committee structures in those committees that intersect with education policy most closely. But we'll be working on building those relationships. At the federal level, when it comes to Congress, we saw while the control of the Senate is still in play, the Democrats did retain control of the House of Representatives. We'll have to see what happens with those two special elections in Georgia in January to determine who ultimately controls the Senate. But it's looking like the Republicans will retain a slim majority in the Senate. And of course, that would mean that Senator McConnell from Kentucky maintains that senior leadership position in the Senate and an incredibly powerful role representing Kentucky in Washington. Also, with the committee in the Senate in Washington that primarily deals with education issues is the HELP committee that has for many years been chaired by Senator Lamar Alexander from Tennessee. Senator Alexander is retiring, and so that will, as is Senator Enzi from North Dakota, and so that will lead to some changes in leadership structure on the HELP committee. We'll see Senator Burr from North Carolina be promoted up into the leadership role, likely be put in the leadership role on the HELP committee, and that will move Senator Rand Paul into the next leadership committee. Senator Burr from North Carolina has indicated that he will not seek re-election in 2022, which potentially could put Senator Paul in the leadership role or chair role on the Senate HELP committee. So some potentially exciting changes when it comes to leadership and Kentucky's power position in Washington because of those two roles. At the presidential level, it's looking increasingly like Vice President Biden will prevail, although there are certainly lots of questions and arguments about the election outcome. And the president is certainly able to file all the lawsuits he wishes to seek clarity and a final determination on the presidential election, but it's looking like Vice President Biden will prevail in that. If that ends up coming to pass, we will see a new Secretary of Education come on board, which may have significant impacts on some of the questions that we're struggling with around assessment and accountability for the spring. Secretary DeVos had communicated with states that the U.S. Department of Education was not interested in granting any waivers from assessment or accountability for the spring. Of course, that was issued in September, and there's a lot that we don't know about what March and April may look like with COVID in Kentucky or all around the country. And certainly we may see a different dialogue and different policy position on that with a different Secretary of Education should Vice President Biden ultimately end up prevailing in the presidential race. So lots of potential changes at the federal level, some stability when it comes to Congress, and certainly a great deal of stability when it comes to our local state house races here in Kentucky. But just a quick update on what election outcomes mean in terms of education policy. And with that, I want to turn things over to our Chief Communications Officer, Tony Tapman, to review some communications items with you. Go ahead, Tony.
Great. Thank you, Commissioner. I will go ahead and start with, just want to make sure you all, Commissioner, can you see my screen?
Yes, I can.
Perfect. So I want to first of all start with a reminder that we are seeking nominations for the, we've now renamed it, the Kentucky Board of Education has renamed it strategic priority, and I'm going to stop my video because I'm getting a little bit of feedback here. The Strategic Priority Award, we are accepting nominations through November 18th, and this will be presented at the February board meeting. So we are hoping that you all will find someone who meets the criteria. This is significant contributions to improving or sustaining really any aspects of district operations throughout the year, this past year, and demonstrated leadership and measured efforts to meet academic, social, emotional needs of students. So please get those nominations in. I believe that we have received about 11 so far. So we will be getting those through the 18th. Also a reminder that the Commissioner's Keep, Stop, Start survey is out. We are having that survey open until the 20th. And currently we have just about 2,700 responses. That includes about 26 superintendents. So if you have not yet taken that survey, please do so. It only takes about 5 minutes of your time. It's not very long, but it's very valuable feedback that the Commissioner is seeking as he crafts together a plan based on what you believe is working in Kentucky for education and what is not. And so we're just looking forward to putting those responses together and seeing what comes out. And there's a link there as well that you will receive in an email with me with this PowerPoint. We are wrapping up the Coverings for Kids initiative with the First Lady and Lieutenant Governor. The statewide promotion of the initiative has essentially wrapped up, and right now we are trying to find out how many masks you might need. So I did send out an email to all of you superintendents yesterday. If you are in need of masks, please contact Tiffany Meredith in the Office of Communications in the Office of the Commissioner. And so we can work on getting those masks delivered to you. We have a large amount of masks that have been donated by individuals and by different companies, and we want to make sure that we get them to you if you are in need. I'm very excited to announce here shortly that we have 2 names that have been forwarded to the U.S. Department of Education for the Recognizing Inspirational School Employees Award. This is the first time that this award has ever been given. And to these are 2 classified staff employees from Kentucky that will be announced by Governor Beshear likely within the next week during one of his press conferences. And then we will plan a celebration probably for sometime in December. At this rate, probably a virtual celebration. But very impressed. We had 96 nominations come in for this, and I just want to thank every one of you that submitted. We had several nominations from superintendents and district leaders and cooperatives, and I just want to tell you how much we appreciate you taking the time to do that. I also want to give a shout out to our Kentucky Teacher of the Year, Mr. Donnie Piercy from Fayette County. And also our other awardees, Laura Peevely, the Middle School Teacher of the Year from Jefferson County, and Mr. Christopher McCurry from Fayette County as well. In your PowerPoint, you will find links to stories about each of these teachers. And as you can see, we were able to kind of surprise Mr. Piercy. He just so happened to live about 2 or 3 minutes from where we had the virtual ceremony. So you can see Superintendent Koch there, and Valvoline and also Commissioner Glass were able to kind of show up with the check at his house. Our future date for the Superintendent Webcast is next month on December 1st, and the time will remain the same from 2 to 4 p.m. And with that, I will hand it off to Robin Kinney. If Robin is on.
I am, sorry.
That's okay.
Welcome, everyone. It's nice to be with you today. A bit of good news on the budget front for this fiscal year. Wanted to make sure that everyone was aware and had heard the good news about the um, uh, news that we are not going to have to implement the budget reduction plan that was proposed earlier. This was announced at a governor's press conference and was followed up again today. Um, Today, the Department of Education appeared in front of the Budget Review Subcommittee on Education and spoke to this. And as well, State Budget Director John Hicks, who is representing the governor's office, appeared in front of the Interim Joint Committee on A&R, and I think that is still continuing right now to give updates on the budget for this fiscal year as we look toward next fiscal year as well. It is that time. We are typically used to doing budget preparation in those once every 2 years, but as we recall, there was only a 1-year budget passed for this fiscal year, and so the General Assembly will have to tackle that again at the beginning of the session once they convene in January. So Director Hicks was announcing that even though originally predicted a shortfall for this fiscal year of $242 to $504 million, that has now been adjusted back to $99 million. And some additional good news that he was reporting on, he believes that through more flexibility on the Coronavirus Relief Fund, which is a separate pot of money afforded to the Commonwealth of Kentucky, that even that $99 million for this fiscal year could be reduced even further. So we may see some of that as the budget office submit their recommended budget amounts to the General Assembly for this upcoming session. So good news. I do believe that Senate Bill 177 and the actions that the department and the board and the General Assembly have taken, along with the governor, to have that continuation of the 1819 or 1920 AADA data to still continue to be applied, has really helped everyone with a little more predictability to our budget. And so we'll continue in that manner in trying to keep you apprised as we learn more for both this year's fiscal impact and as we prepare for next fiscal year. And that's all I have, Tony. So back to you, or back to Commissioner Glass.
Back to me. Thank you.
Okay.
Thank you, Robin. Thank you, Tony, both of you for your presentations. When I was hired into this role as Commissioner of Education this past summer, of course, the country was in a lot of upheaval over the murder of George Floyd and the killing of Breonna Taylor here in Kentucky. And a lot of the unrest when it came to police violence issues also led to conversations around, renewed conversation around equity and systemic racism bias that may exist in public school systems. The Board of Education here in Kentucky passed a resolution in August that really laid out anti-racism and equity as major priorities for the Board of Education and for this organization, and also for me as the incoming Commissioner of Education. So that's been elevated as a major priority for me by this board, and it is the right and moral thing for us to do as educators in the Commonwealth, to use this opportunity to raise up questions around equity and inclusion and making sure that we're meeting our moral obligation of serving every single student in Kentucky schools. One of the things that I have been able to do in making progress on that front is to hire an incredibly talented Deputy Commissioner to come in, and that is Dr. Thomas Woods Tucker. Thomas and I had the chance to work together. We were in adjacent districts in Colorado, but Thomas's career spans from Arkansas to Kansas to Ohio as a teacher and administrator and as a superintendent and a former National Superintendent of the Year. So we're thrilled to have talent like this working with us in Kentucky and at the Kentucky Department of Education. And I want to just use this as an opportunity to introduce Dr. Woods Tucker to you, and also to turn things over to him to lead you through some of the early thinking that we've been doing around diversity, equity, and inclusion in our schools and next steps and what we might expect ahead. Thomas, go ahead and take it away.
Commissioner Glass, thanks for those very, very kind words. I'll use those kind words for the next month, so thank you. Hello and welcome to everyone, all of our superintendents and all of our guests who are out there. It is my esteemed pleasure, my honor to join you all in the Commonwealth here in Kentucky to raise achievement for our students, remove barriers and obstacles to learning for both students and staff. So thank you for this tremendous opportunity. Dr. Glass also said I will be speaking just a little bit today, so I'll try to stick with that. But there are a few observations in my two plus weeks that I have here in the district, and I have some talking points that I will present to you. And Tony and I created these slides and talking points really for your use. I won't go through and spend a whole lot of time on those, but there are some things that I believe that will be of interest, hopefully, to you that I want to make a point of. And then also, please feel free to use the soapbox, the chat box, to put any questions that you have, and I'll keep an eye on that box as well as Tony. So let's go ahead and get started. When I came here to the Commonwealth and began to look at the great work that you all are doing, folks who have boots on the grounds, our teachers, staff, superintendents, and so forth, as well as the remarkable work that's happening here in KDE and our State Board of Education, I looked at what are the goals here? What are the two most important, most pressing goals that I see in terms of our work? And I wholeheartedly believe that all of our schools, and I don't think you'll have anyone to disagree with it, that they should be safe havens where all students and staff, regardless of their zip code, their ethnicity, their sexual orientation, gender expression, or their ability, should feel safe, respected, and welcomed. And I really believe that's the heart of our work, ensuring that all students and staff feel safe. That's also at the heart of our work in terms of broadening the definition of inclusivity, broadening the definition of equity as well. And our department here, we here at KDE, we want to support and assist all school entities in your efforts to expand diversity, equity, and inclusion efforts. And I know my friends here at KDE have heard this quite a bit over the last 2 weeks when we talk about what I see as our main point of emphasis, and that's for each of us to identify and eliminate those barriers and those drivers in our schoolhouses that perpetuate inequities for all students, again, regardless of their zip code, regardless of their sexual orientation, regardless of their ability, getting back to our original goal and purpose. And then along with that, as Commissioner Glass said, we need to ensure that we are providing opportunities and advancement at the same time for each one of our students, because it is the right, is the educational, and it's the moral thing to do. Again, please continue to put any of your thoughts that you may have in the soapbox. And also, we have a Google form that Tony has created for you to put some thoughts in there as well. So as I take a quick scan here, and folks, I'm not coming here knowing everything. I haven't been in any place where I've said I've known anything, but I want to share with you a quick scan of some things that really resonated with me since I've been here. And I think that we need to, there needs to be some acknowledgement that our teachers, principals, support staff, and you, our superintendents, our building leaders, you're facing some of the most difficult challenges in the nearly 400 history of public education. And it's heightened by bipartisan politics, which have been around, and I'm not just talking about for the last 4 years, but they've been around for a while. The racial tension that Commissioner Glass talked about, and that is real. That is, make no mistake about it, the racial, the ethnic tension certainly is there. Then also the uncertainty of the new educational policies in Washington, D.C. We don't know what platform our new Secretary of Education will take. Hopefully, it will not be as controversial as our current Secretary of Education, but really, we don't know. We hope that policies are clear, and many of you have connections across the state and the country. There are names blooming everywhere in terms of who that person is. But I certainly hope that it will be someone who's willing to unite us educationally, someone who's not setting up roadblocks and barriers. The American Association of School Administrators, of which many of you are members of, have sent out a statement to the Biden administration, to President-elect Biden, to say, here are some of the qualities that we want in our next educational secretary. And again, I certainly agree with our folks at AASA and these other groups that it has to be someone who's going to make things smoother for public education. But one of the things that have kept me up, not just since the time I've been here, but over the last year and a half, is that how do we take care of our social and emotional needs of our students, staff, and yes, you superintendents during this time. In March of last year, we were dealing with COVID, the start of COVID, and you're still dealing with it. I get it. I was a district level superintendent for nearly 13 years. But we need to make sure that we're taking care of each other. What are you doing? What are we doing to take care of each other? Because if we're not taking care of each other, there's no way we can take care of our students, regardless of the mode that we're using to educate students, whether it's in person, hybrid, or students are totally remote. But if we don't take care of ourselves, we don't take care of the social and emotional needs of each other, then it's going to be very difficult. In my short time here, I do know that you all have some very, very talented resources that you can use in your buildings. And they're probably some of the most underutilized folks. And I'm talking about our school counselors, our psychologists, and social workers. But I'll add another dimension, and we were very successful during my time in Denver. We were able to pull in our community resources. We have folks in our communities, and I know communities are different. They're constituted differently. Some communities have more resources than others. But I wouldn't be shy to bring in community resources because we know we can't do this alone. It's going to take a full effort by the school district, the social sector, as well as our business partners in addressing these social and emotional needs of our folks. And then the next observation I would like to make is that there has to be an acknowledgement, a real acknowledgement that diversity, equity, inclusion, and social and emotional learning are drivers within our curriculum. In addition to being the Chief Equity Officer, I also help lead the Department of Teaching and Learning. Curriculum cannot move forward without respect paid for diversity, equity, and inclusion in addressing the emotional learning needs of our kids and of our staff as well. I had the pleasure of meeting with the Office of Teaching and Learning today, and I ask you all to go back to your buildings and lean heavily on the support that we have here. We have some very dedicated and talented people here. And we're, again, fortunate to ensure that when we look at curriculum, we're looking at curriculum at a lens of diversity and equity. And that certainly was one of the attractive things with me coming here, because I said it's very important that our kids, regardless of their uniqueness, they need to see themselves in the curriculum. We talk about critical pedagogy. We can talk about it, but do we really mean it? I don't think we mean it unless our kids can say, yes, I see myself in the curriculum. I see myself being represented. Then also, there's an awareness that societal issues that impact our communities also impact our schools. Many times we try to get away from that. I know I was talking with the commissioner earlier, and there was an entity that said, well, schools should not be in that business of educating and addressing certain societal issues like racism and diversity. That's not right, because our kids bring those experiences to the classroom. They bring them to the classroom, they impact them. It's just like saying that if we don't properly give kids the nutrition that they need, then our kids can come to school hungry and they're going to function right. We found that doesn't work, that we need to ensure the kids have the proper nutrition that they need. And so they do bring those issues to the schoolhouse, and we need to address them. And we need to also address these issues directly and to collaborate and work together as a unified community. Okay, Tony. I'm proud, again, when I look at the department's commitment to equity. As many of you know, the Kentucky Department of Education identified 4 strategic priorities, and it started out with equity. Equity for all students, for each student, achievement for each student, collaboration as a state, as a commonwealth, and integrity. In July, as many of you know, the Kentucky Board of Education affirmed its commitment to racial equity and racial justice in all schools in a resolution. And I'm here to tell you, colleagues, that was extremely powerful, extremely powerful. It's powerful when our local boards of education do it, but my goodness, when a state board of education puts an emphasis on racial equity and racial justice in all schools, that's saying they're committed. And it also, as local superintendents and as local leaders, it gives us support and it gives us coverage, because we all know that we have 1 or 2 folks in our community. Well, maybe Kentucky doesn't have 1 or 2 folks in our community that does not support this, but we do know we have our detractors out there. But when your state board of education and your commission of education all support this work, we're standing united. So that was a major point for me, again, in taking on this work. And 3 things that I was able to pull from this, and I'll summarize them very quickly, is that educational leaders, we must embrace diversity and ensure equality to shape the future of Kentucky. Because if we don't embrace diversity and ensure that all of our students have what they need to be successful, then it's going to greatly impact the future of all of Kentucky's children. And also, every student in the Commonwealth deserves equitable access to excellent educators. And this also includes support staff and superintendents and building principals. And that we value these students' unique perspectives, and that we have educators committed to their success. And thirdly, educators, schools, and districts must commit to listening to those seeking to be heard. We need to ensure that our students have a voice, and that we're sincerely listening to them. We're sincerely listening to our young people. I was also pleased to see that the Kentucky Board of Education, I think it was last year, elected its first student to sit on the State Board of Education. That's a powerful message. That's a powerful message that students' voices should be heard. And I'm sure some of you have student representatives either at your board meetings, or they may sit in on the dais at some of your board meetings, ensuring that we hear the voices of our students, especially the voices of many of our students who have been disenfranchised, our poor students and our students of color. And we need to make sure that they feel safe in our communities. And I believe this begins with having a courageous conversation about equity, and that's huge. I mean, and it's tough, especially if we have not had those conversations. And I'm very happy that the department has put out some guidance, and I'll talk a little bit more about that, and you'll have the link to how you start if you have not started these conversations. And again, I don't want to assume that this work is not being done. I know many, in fact, I know several superintendents, several of you here on this call here, and I know some of the work that you're doing. I know Superintendent Koch was the state superintendent of the year, and as a matter of fact, he was certainly one of my top 4 for National Superintendent of the Year. So I know the work that's happening in the Commonwealth, and a couple other folks have done great work. And so I know what's going on. I know you're fighting every day. But when we look across, we take a quick look across this country here, there seems to be a lack of understanding among stakeholders in terms of what equity, equality, and inclusivity mean in our schools. And the second part of that is that how do we have these courageous conversations, create common ground to support all of our students, and how do we broaden the definition of diversity? And I'm going to talk a little bit about that, because many times we think when we look at diversity, we're only thinking about ethnicity or skin color. Each student comes to school with unique needs. And so we need to look at how do we broaden it, that definition? How do we address students from the LGBT community? How do we continue to address our students, regardless of their ethnicity, who are coming to school hungry, who are coming to school without the resources that they need? So we need to continue in this country here embracing the idea of diversity. And then thirdly, how do we ensure that students see themselves in the curriculum? I talked about that a little bit. We talked about critical pedagogy. Are we ensuring that when we select textbooks and curricular resources, are we ensuring that students and parents have had a voice in that, and that students actually see themselves, see their ethnicity represented in the curriculum? Again, those are powerful things as they relate to beginning this courageous conversation about the equity work we're going to do and continue to do here in the Commonwealth. Recently, someone asked me to define equity, and this is my personal definition and definitions I've picked up over the years. When I look at equity, it's about providing each student the resources that he or she needs to be successful. And there's a recognition, colleagues, that every student does not need the same thing to be successful. And you contrast that with equality. Equality is treating every student in the same manner, irrespective of differences, and assuming that all students have bootstraps. When you look at the socioeconomic status of students across this country, there are some students who cannot afford their own boots, thus they don't have bootstraps. And then there are students who have 10, 11 pair of boots. And so we can't walk, or we certainly shouldn't walk into a classroom or walk into a school and say that we're going to give every school the exact same resources or exact same funding that they need, especially when we look at how schools are funded here in the Commonwealth and across this country. So again, we need to look at the differences between equity and equality and fight to see our students as unique individuals. Then also inclusivity. Again, that's ensuring all stakeholders, parents, staff, business leaders, community members, again, and of course our students have a voice in the educational process, that they have a say in their education. Tony, are we getting any questions either in the Google Doc or any other questions in the soapbox?
I will go ahead and check that if you want to keep going on, and then I'll get back to those in just a second.
Okay, very good.
Okay.
And in wrapping up my conversation with you about a courageous conversation, we need to continue conversations about racial trauma and implicit bias. These are two important topics that our Kentucky Board of Education and I know our commissioner greatly believe in, and I see this work happening in some of the districts across the Commonwealth. And it's needed, regardless of the racial makeup of your schools, whether your school is a majority of one ethnicity or not, it needs to happen in every school, because once our children leave school, they're going to mingle in higher ed, they're going to mingle in business or some shape, form, or fashion. And they need these critical skills so that they can better understand each other. And these events, again, they impact all of us. If we do not address the emotional and traumatic consequences of things that students have experienced. As many of you know, in June, which I talked about earlier, the Kentucky Department of Education issued some guidance on how districts can facilitate conversations about race-based stress and trauma. If you've not read that piece, I would greatly suggest that you do. And it was prepared right here by staff, by the Kentucky Department of Education's cross-agency trauma and resilience team, in partnership with colleagues from the Kentucky Department for Behavioral Health and Development and Intellectual Disabilities. So it was a cross-agency effort and a very, very solid document to help us have these conversations about race-based stress and trauma. Another initiative that I know many of you are concerned about, and some of you have already reached out to me about, and that's about the recruitment, development, and retention of a highly effective, diverse, and culturally competent workforce. You know, what are we doing here? We're going to continue to look at some of the best practices to do that. We know the challenges of creating such a workforce is well documented, but we do have some exemplars, or better exemplars, here in Kentucky, and we have some across the country, because we know that this is going to be key to the successful development of our students in helping them to be competitive, not only here in the Commonwealth, but across this country. So I've heard that. I know that's a major issue, again, from you all, as well as from the State Board of Education. Okay, Tony. One of the things I wanted to do in coming here, again, not to assume that certain things are happening or they were not happening, but I wanted to take a quick scan. And I need your help. I really need your help in helping to understand the efforts and the activities that are happening along the lines of equity in your district. Some of the questions I will ask you, and where I really need your help, is that when you look at your buildings, when you look at your schools, what are some of the existing equitable practices in your schools, in your district, that emphasize racial equity, inclusion, and diversity? What do you have in place, and how can we take these effective things that you do have in place? How can we replicate those successful practices? And then, does your district have an equity and inclusion action plan, or is equity included in your district strategic plan? I know many of you have updated and active strategic plans, and I'm pretty sure that equity is probably one of those points of emphasis in your strategic plan. So, does it cover equity? And I want you all to know that as we look at this scan here, this is just the beginning. As I and our colleagues here at the Kentucky Department of Education try to understand this business of equity and what's happening in the district, we hope within the next coming months that we can create our own equity toolkit, and that we can have outreach efforts like professional development to help you increase equity, diversity, and inclusion in your district. Tony, I think I may have one other slide. So in order to better understand what's happening, in our 171 districts, I need your feedback. And I'm going to give you a quick Google form here and ask about 6 or 7 questions along the lines of equity and inclusion. And these are some of the questions, folks, that many of you have seen before. And there are generally some questions that districts who've done this work are generally asking. And again, it's going to ask questions about what systems do you currently have in place. And equally important, again, our job is to be a resource for you. How can we best support you in creating more inclusive learning environments for all students? In meeting many of our folks here in the Kentucky Department of Education, and some of these folks are online right now, they have the skills, the desire, and passion to really help us in this work. And so I want us to lean into these folks as well as we go about this work. And we ask that you complete this Google form, because on December 8th, KASS has asked me to speak at their conference for about 15 minutes regarding equity, regarding diversity and inclusion. And so what I want to do, I want to highlight where we are right now, and I can do that if you please take a few minutes. It won't take a whole lot of your time to give us an idea of where we are regarding equity and inclusion. And then secondly, I don't want to assume what is happening in the Commonwealth and what is not happening. And I don't want you to say that KDE has hired a deputy commissioner who's in charge of equity, chief equity officer, and he has all the answers. I don't. You all have the answers. You're in the field, and I want to share some of the great work that you all have, and we here at KDE want to be a fantastic resource for you. Tony.
Yes, I am here. I am
Okay.
here.
Next
Yes.
slide.
And I think that was your last one.
Okay, very good.
Okay.
Thank
Thank you, Dr. Woods-Tucker. Yeah,
Sure,
anything
sure.
else you want to close with?
No, that's it. Again, I am pleased to be a part of the great work that's happening here, to be a resource and to further this very, very important work by the Kentucky Department of Education, the Kentucky Board of Education, and our local school districts. And I'll take a few questions. Commissioner Glass, if I haven't used up more time than I was allotted.
Tony, do you want to have any questions now, or do you want to wait till the end? What do you prefer?
Let's go ahead and wait until the end, because we're about 15 minutes away, and we'll just go ahead with the DPH and then we'll start the questions about 3 o'clock.
Sounds
Okay.
good. Thank you.
All right.
Thank you, Thomas. Now
Absolutely.
we want to turn things over to our friends at Department of Public Health. We have Dr. White with us, frequent guest on our program. Thanks, Dr. White, for being here. We also have Allison Kavanaugh on with us as well. They're going to talk a little bit about quarantining updates, but just as a preview to that, I think this conversation is becoming really important as the number of cases in the state and in our communities continues to grow. The number of COVID cases that are in our communities puts all the more pressures on the mitigation efforts and the defenses that you have in your schools. And so what we're starting to see is that if schools are reach that red level, some of them are shutting down. But even if they're not, the numbers of individuals, students, staff members, community members who end up having to quarantine are creating disruptions in school operations. Because if you lose a whole family and that family has a student in school and one person works and drives the bus and someone else teaches, that has an impact on school operations. So this question of how quarantining is taking place is an important conversation right now. Dr. White, let me turn things over to you. And I know you've got a few slides to walk us through. And thanks again for being with us.
Thank you so much for having me, and thank you for letting me listen in on that conversation with Dr. Woods-Tucker. I see a lot of collaboration that's going to happen with him and the Department of Public Health and our Office of Health Equity. So I was pleased to hear that, and thank you, Commissioner, for luring him to Kentucky, because I think we have a lot of great work that we can do in the whole state of Kentucky, not just the school system, but the entire state. Thank you for letting me be here today. I just wanted you guys to know, we mentioned this the other day, that we had a webinar last Thursday with the school nurses and with the district health coordinators. Right, district health coordinators. I always get that wrong. That we had a presentation. 2 things were presented. One was we had 4 different schools and local health departments that presented the way that different ways that they are supporting each other in contact tracing. We had that webinar because since I've been coming to visit with y'all since April, have talked about, contact tracing, public health's got that. That's what we do. We do it all the time. We do it with measles. We do it with mumps. We do it with other things. We're hiring 800 more people to bring us over 1,000 contact tracing workers in the state of Kentucky. I don't think anyone anticipated the numbers of cases that we're having and exactly what that volume will mean. And so that's why we invited these different school systems and different health departments to show how they are working together to try to be sure that this is done as efficiently and effectively as possible. What you don't want is you don't want kids or faculty or staff that need to be quarantined still being present in your school system because you don't want to take chances of spreading the virus, which is wonderful. And I would give you all a honorary master's in public health if I had the authority to do that. But I think we are understanding the sheer volume is overwhelming. And so it was interesting that I put out a message and said, does anybody in the public health world want to come and talk on this webinar? And I immediately had 5 schools contact me from all across the state. From Christian County up to Bracken County, Woodford County, Shelby County, Nelson County. Every single one of them were doing it differently. They had different personalities, they had different skill sets, but they had come up with a way that someone at the school system was helping feed information to the local Department for Public Health, so that these kids, obviously the kids that are positive or the person that's positive is put in isolation, but those other people, close contacts that are high risk that need to be quarantined, could get in quarantine as quickly as possible. Let's bring up that first slide, Tony. The governor calls it the purple, the stair step slide. I call it the purple slide. This is something that, as I said, this is pretty overwhelming. So here are our cases. Every purple bar, you've seen this before, every purple bar is a week, the total number of cases. So we go back to, not quite yet, Tony, we go back to March, where we had our first case of 4. And then we had that increase up until April, where we had 1,000 cases a day, and we were running 1,000 to 1,500 cases a day. And where the yellow arrow is where we released the Healthy at School document. We thought we had a lot of cases back then. 1,221, we had more cases than that yesterday in a day than we did in that whole entire week, where the yellow arrow is. The next slide shows us where the mask mandate was initiated. That's because we went from 1,675 to 2,482 to 3,772. And the fear was that the next week was going to be 6,000, the next week was going to be 12,000, and we would be at an exponential rise. And you can see that putting that mask mandate in place did halt things for a while. That it halted the growth. It didn't get rid of the viral spread, but it did slow that down. And then the last arrow that Tony's going to show us is when full school reopening. That was that September the 28th. Many schools opened before that, but all schools were given the green light to go ahead and open on the 28th. You can see what happened after that. It is not a school problem. This didn't happen because of schools, because what happened before that was we had, as I call it, the exacta, the weekend of Labor Day and Derby Day. And I think there were lots of private gatherings, private parties, family gatherings, and we started to see those cases go up. Now you see, last week we had 12,196 cases. I think Dr. Stack added that up. 12,196 cases is the number of cases we had in the first 15 weeks of this pandemic in Kentucky. And we managed to do that in 1 week this last week. That small bar of 1,729, that's just what happened yesterday. The weeks that we measure start on Monday and end on Sunday. The next slide is what you will have seen the governor present. We thought this was important information for you to see. On the very far left of the slide shows what hospitals were reporting as far as inpatient census for patients diagnosed with COVID-19 at admission diagnosis. We got a very robust system starting August the 1st. We'd been tracking this before that, but we feel real confident with this system that we're using now that we're getting really solid numbers. So I wanted to show you that. So you can see that starting August the 1st, we had around 600 patient census a day for COVID-19 infections. But you can see probably, I'm not an epidemiologist, so Dr. Kavanaugh would probably frown on this, but I'm kind of squinting here and saying that around October the 4th is when we started seeing the numbers of inpatient census go up. Next slide, Tony, shows us not inpatient hospital census, but it shows us the ICU census. And the very same time, about October the 4th, is when we started to see that incline, and it has continued at the same rate since that early October date. And then the last slide that I have shows you the number of people that are on a ventilator in the state of Kentucky. You can go back to early August and you see there was an increase there at that point in time, but nothing like what we're seeing now of the ventilator situation. So I'm telling you all this because some of you may or may not watch the governor's press conference, and he started showing these pretty regularly. I think it's just to let people be very clear that we are talking about hospital capacity. So everybody understands what I'm looking at when I look at the data and go home at night and think about this. I think that you all should be very proud of the work you've done. You've done an excellent job with following the Healthy at Schools document. Not everybody has, but I would say that most everybody has. And you've worked to keep your students and your staff safe, and that's to be applauded. We talked at the very beginning about how you are the thought leaders in your community, and you're the ones that are going to help to make a difference. I wish we could get other parts of your communities to elevate themselves to the level of work that you have done. But right now, as of yesterday's press conference, I don't have the map in front of me for today, but as of yesterday's press conference, we only had orange and red counties in Kentucky. We had no yellow and we had no green. We can turn this around. You keep fighting the good fight that you're fighting and protect your staff and your students like you are. With that very nice hope of a vaccine, it won't be until next year for most of us to get it, but with our not letting our guard down and being sure that we're consistent with our work in our schools will be important. At 4 o'clock, when the governor does have his press conference, I was hoping again that I could actually do a scoop and show you the Thanksgiving protocol, but I'm a deputy commissioner of the Department for Public Health. I don't get to scoop the governor. So the governor this afternoon, I've been told, is going to release the guidance for Thanksgiving. But it's not anything any different than we've been talking about. If we go back to Miss Virginia, when she says hands, face, and space, that's what you're going to be looking at for Thanksgiving. Think about who's going to be sitting around the table and figure out are there any of those people you don't want to see there next year, or maybe not even at Christmas time. We've got to be very careful with our small gatherings in our homes. Just because it's a family member doesn't mean that they couldn't be an asymptomatic carrier. And when we sit around the table for a long time and laugh and talk and tell our jokes and without our masks on, that's when spread's going to happen. I'm very concerned about Thanksgiving, and I just appreciate the fine work that you're doing for protecting our young people as well as our staff in the school system. At that webinar I talked about last week, we had Dr. Doug Thurman, who's the acting state epidemiologist for the Kentucky Department of Public Health, was our presenter. He did such a wonderful job. He was asked to come back. Fortunately for him, something else came up that is good for him. So we're glad that he was not able to come, and we are extremely thankful to have Dr. Allison Kavanaugh with us. Dr. Kavanaugh is also a CDC field officer, just as Dr. Thurman has. Dr. Thurman's been here for 11 years in Kentucky, and Dr. Kavanaugh has been here since August. I told her it seemed like she'd been here forever, but it seems like she just got here yesterday. So two months is pretty close to yesterday. She has got the slides and the information that Dr. Thurman gave, and it seemed to really hit a chord with the school nurses and with the district health coordinators, and so we were asked to come and share this information. So Dr. Kavanaugh, I will turn this over to you.
Okay, great. Thank you, Dr. White. Can someone just confirm that you can hear me okay? This is a new headset for me.
I
You
can hear
okay?
you.
Okay, perfect. Well, thank you so much for inviting me to come and talk. And today I want to just talk a little bit about quarantine. There's often many questions about quarantine, and there's a lot of confusion sometimes between quarantine and isolation. Why do we quarantine, et cetera? And so I'd like to take a little bit of time just to go through why we quarantine, how effective it is, and what are the steps of quarantine. So what is the purpose of quarantine? Quarantine's purpose is to reduce the transmission of disease. Now, quarantine is one tool in the public health toolbox, and we have several. So we have isolation, we have quarantine, and now these are two separate things. They are two different tools that we have that often get confused. We'll go over the definitions in just a minute. We have vaccination, and as Dr. White just talked about, we got some good news yesterday, and that was spread throughout the media. And so we're hoping that vaccination is a tool that will make an impact on the transmission of disease in the future. We also have hand washing, we have mask wearing, we have many tools in the public health toolbox, but these are the common ones that we're hearing about quite a bit right now, and that have been known to be effective in reducing transmission of disease. So what is quarantine? Quarantine removes a person who's been exposed to a disease from contact with others. We quarantine so that we can reduce the risk of transmitting that disease. So again, quarantine removes someone who's been exposed. This is before they express symptoms themselves. So quarantine is different from isolation. Isolation removes a person who is confirmed to be a case. This is a person that we know is infected. And so the purpose of isolation is to remove the infected person from others to help reduce the spread. So isolation, we remove that person for that entire time that they are deemed to be infectious. And so isolation typically will be on a 10-day period. So typically when you get infectious from the time that you have onset of symptoms or until you get tested and are shown to be positive, you're typically asked to isolate and remove yourself from others for 10 days, as long as your symptoms have started to improve during those 10 days, and as long as you don't have a fever within the last day without using any type of fever reducing medication. So some people will need to isolate a little bit longer if their symptoms haven't improved, and which would mean that they may continue to be infectious. So isolation is typically 10 days from that time that you first demonstrate symptoms, or from that time that you're first tested if you're asymptomatic. Now, it's important to note you're infectious from the day that you start developing symptoms, but you're also infectious for those 2 days prior. So the effectiveness of quarantine, how effective is it? Quarantine is not a new tool. It's something that has been used for centuries. And quarantine has been used for centuries because it can be an effective tool. Now, how effective is it? It depends on the characteristic of a disease. So first we look at how does disease typically spread. There's many different ways that disease can spread. Droplet spread is typically what we'll talk about as the most common way that SARS-CoV-2 virus, the virus that causes COVID-19, spreads. And droplet spread is particles come out of a person's mouth or nose when they're sneezing, when they're coughing, when they're talking, when they're breathing. These droplets go out into the air. They may remain in the air for a period of time, and then they typically will fall to the surface within close proximity to where that person is. So typically, in terms of SARS-CoV-2 or coronavirus, we think that most particles will come out of an infected person's mouth, suspend in the air for a short period of time, and go to the surface within around 6 feet of where that person is. Now, there's other types of spread. Airborne spread is when there's smaller particles that remain in the air for an extended period of time. So things characteristic of airborne transmission would be something like the virus that causes measles, where these particles may remain in the air for an extended period of time, up to several hours. There's other diseases that spread through that fecal oral route. That's why we say always wash your hands before preparing food, always wash your hands before eating. There's different pathogens that'll spread through food or waterborne transmission. And there's also pathogens that spread through surface contact, which we also know that SARS-CoV-2 or coronavirus is able to spread through surface contact. So the virus may remain on that surface. You may be able to touch that surface. And then if you put their hands to your eyes, to your nose, to your mouth, that pathogen can then enter, that virus can enter the body. So quarantine can be effective for different ways that it's spread. It can be very effective for respiratory conditions like SARS-CoV-2. We know that for other types of transmissions, this is not an effective way. And just an example to contrast that would be back in the 1700s, they tried to quarantine for yellow fever without recognizing that it spread through mosquitoes, and therefore keeping someone separated from others didn't work. But for SARS-CoV-2, which is spread primarily through close contact from virus particles that exit someone's mouth and nose and can come in contact with someone else, or from surface contact, quarantining someone who potentially could become infectious would be an effective way to help reduce or prevent some transmission of the disease. Now, quarantine needs to be effective based on the incubation period of the disease. An incubation period is the time from exposure to the time of developing that illness. And the incubation for the disease for COVID-19 is 14 days. And that's why we will say that quarantine will last 14 days from the time that you've been exposed. At some point during these 14 days, illness may develop. And so the quarantine would have to last the entire incubation period. Now, how effective a quarantine is depends on how quickly that exposed person is identified. And I think we talked about this a couple of times, and Dr. White talked about this. The number of cases that we are identifying in Kentucky is rising very fast right now. And that is really putting a burden on those local health departments in order to reach out and contact that infected individual, to find out who are their close contacts, and then get those close contacts quarantined. But how quickly that exposed person is identified will make a huge impact on whether they will eventually spread disease to someone else. Lastly, how effective is a quarantine? This depends on how complete that quarantine is. Ideally, the person who's quarantined needs to be removed from all others for that entire quarantine period. And so what we're seeing, what we're hearing now is different cases where individuals will not participate in school settings, but they want to go and participate in the different extracurricular activities or sporting activities. Well, that's great that they've reduced their contact in the school, or they've reduced the likelihood of transmitting the disease in that classroom setting, but they are still exposing others to risk by breaking that quarantine and participating in other activities. So that's something, if it's not a complete quarantine, you are still putting others at risk. Next slide. So how does the COVID-19 quarantine work? First, a positive case patient is identified. So if someone tests positive for COVID-19, the local health department will reach out to that individual and they will interview them. The interview, first of all, we want to make sure that they understand their own isolation protocols and how they need to stay in their house and avoid contact with others. But part of this interview is also to identify who are their close contacts. And so the CDC has a definition of a close contact of anyone who was within 6 feet of them for more than 15 minutes of exposure within a 24-hour period. And these close contacts have a higher risk that they themselves may develop the disease because they had a higher probability of being exposed to the virus. Now, there are other considerations and that would come into play here about the risk. So even if you weren't next to someone for a full 15 minutes, but someone who was positive or a case had coughed on you or sneezed on you, obviously that increases the amount of virus that you potentially could have been exposed to. And obviously that increases your risk of becoming a case or infected yourself. And you may be required to quarantine if you've had some risks, such as being sneezed or coughed on, sharing utensils, or other types of close contact that don't fit very clearly into that 6 feet for greater than 15 minutes. There's other risk factors that we know may increase your likelihood of having been exposed to COVID-19 and therefore potentially developing the disease. And that's if you spend a significant amount of time together in an enclosed space, particularly in spaces that don't have great ventilation. So even if you haven't been within that 6 feet, if you've been a significant amount of time in a room, an enclosed space with someone who has infected, that will increase your risk. So all close contacts will be quarantined, and those are people who have likely been exposed to the virus. Quarantine, again, we want to remove those individuals who have been exposed so that if they do develop the disease, they haven't been in contact with anyone else, and we can stop that chain of transmission. So the COVID-19 quarantine is currently at 14 days, and this is set because the evidence is showing us that most people will become symptomatic within 14 days of the exposure. So COVID-19 quarantine is 14 days, which is actually longer than that isolation period, which sometimes confuses individuals of why someone can have the disease and kind of go out back into meeting with other people earlier than someone who's quarantined. Next slide. So there are a few points that are important to address in terms of key COVID-19 quarantine. Mask wearing reduces the likelihood of transmission. So if you wear a mask, that's a barrier. So if the infected person, the person who has COVID-19, was wearing a mask, virus particles that come out of their mouth or nose may have been reduced. And in fact, some of those particles that would have normally have escaped maybe didn't travel as far. But mask wearing doesn't eliminate the possibility that virus particles and these droplets have come out of the mask and could potentially expose the person who is within 6 feet. So mask wearing is a great thing. We all need to be wearing masks. They will help to reduce the likelihood of transmission. But just because the infected person was wearing a mask doesn't mean that your exposure was zero. And therefore, mask wearing is a tool to help reduce transmission, but it's not a get out of jail free card for those exposed. And if you meet those criteria of a close contact, regardless of whether both of you were wearing a mask or not, you will be asked to quarantine. Testing out of quarantine. So this is tricky, and a lot of people think that once they've been exposed to someone who has tested positive, their first instinct is, I'm going to go get tested, and they'll go right away and go get tested. The problem is that depending on when you get tested, you may not have the viremia or the level of virus that would get picked up and tell you that you have a positive result. So for example, if you've been exposed to the virus and you get tested immediately afterwards, you may test negative because people often do not test positive for at least 2 days after the exposure. So viremia, or the level of virus that a person has, may not reach that detectable level until some point within that 2 to 14 day incubation period. So if you get a negative test and you're supposed to be quarantined and you think, I don't have the virus, and you go out, that may be inaccurate. That meant that you didn't have enough of that virus at the moment that that specimen was collected. It doesn't mean that you don't have the virus, and it doesn't mean that that virus is not going to increase its level within your body and become infectious to others. So at this time, there is no guidelines that are available that allow you to test out of quarantine. Now, a lot of schools, a lot of businesses, a lot of individuals are trying to think outside the box and become creative. They're trying to figure out, how can we be as safe as possible? And I encourage everyone to try and think, how can we be as safe as possible and reduce the likelihood that we would transmit the disease if someone were positive in our environments. What we need to know is that you may have many different protocols that you put into place, which are great, but the local health department is going to be the final authority on whether quarantine is warranted. So you may have many ways that you have developed in terms of other barriers and in terms of scheduling that may be beneficial in helping to reduce. But if the local health department assesses that risk that someone may have been exposed to the virus, they will require that person to quarantine. And so just a few examples, we saw this in workplaces earlier on, and we're seeing it now in schools, where people will rotate individuals every 14 minutes so that they never reach that 15-minute mark. Just remember that 15-minute mark. 15 minutes is just a guideline that tells us that you've had a certain level of exposure, that it wasn't just a very brief encounter. It's a guideline, but 14 minutes doesn't clear you from being exposed. And in particular, 14 minutes wouldn't necessarily clear you from being exposed if you sat in that same room, in that same enclosed space with the other student or with the other faculty member or staff for the entire day. And so the local health department will take all of this information into account when they decide whether this person has risk of exposure and needs to be quarantined. Next slide. Okay. So one of the most important things is every situation is different. It's why we don't have a very distinct list. The local health departments have the experience, they have the knowledge to be able to go in and to interview this case and to get the information and deem what would be considered a high risk versus a very low risk, and when someone would need to quarantine. Now, school settings are particularly difficult because there's a number of factors involved. There could be potential exposure scenarios over multiple days that they're trying to get a good idea of what's happening. Things will be different depending on the age of the child or the age of the adult who's exposed, what the classroom setting looks like, what the type of activities that they were participating in look like. How can schools and public health work together? If schools can help public health by providing as complete a picture as possible, the local health departments can get a really good idea about the exposure risk, the assessment of exposure. So being able to share and to provide information as in terms of where seating happen, where the seating charts are, schedules, where they sat at lunch, how lunchtime typically works, etc. That helps the local health departments to determine, is this a close contact? Is this a high risk scenario where this person has likely been exposed and we need to quarantine them? Now, the local health department does have the knowledge and they have the experience to make a good decision. And like many people in the world today, they're under pressure from a variety of sources, from parents, from the public. And when they make that decision, it's best if we can support them in their decision, help them to do their job. They've taken in all the available evidence that they were able to collect in order to assess risk, and that was their ultimate decision. Now, quarantine and isolation are not fun. It's been a long year. We've all had to make sacrifices. And when someone is asked to quarantine or isolate, it can seem like a punishment, but it is not a punishment for students. It's not a punishment for faculty. It's not a punishment for these sports teams. The reason we are doing it is we know that this is a mechanism and a tool that can help to save lives. So that's the end of the presentation of what we have prepared, but I don't know when you want us to take questions or if we have time for questions, but I'm sure that there's a little bit of questions and people who want some clarification on quarantine and isolation.
Thank you, Dr. Kavanaugh. Thank you, Dr. White. We do have time for questions. Tony has been collecting those as we've gone along. So we'll turn things over to Tony now to see if there were questions really for any of our presenters, but I expect that most of those will be focused on the presentation that we just heard, as well as perhaps some for Dr. Woods Tucker. So Tony, what do we have?
So the first, I will go first, I guess, in order. There was a question for Dr. Woods Tucker that I actually was texted. So I will go ahead and ask that question first. So the question is in regards to curriculum and how our districts can do a better job at engaging our Black and Brown students to ensure that their voices are shared and have choices when it comes to curriculum.
Thanks for that question, Tony. I've heard some key terms in that sentence. I heard voices, I heard curriculum, I heard students, in particular, Black and Brown students. And if we really value voices, and I know we all do, then we create avenues to hear the voices of our Black and Brown students. Again, I'm not suggesting that we're not doing that. Many of you are doing an outstanding job. So what are a couple of suggestions in doing that? One, you want to make sure that those voices, those students, are represented on your student advisory committee. If you don't have a superintendent student advisory committee, I would suggest that you start one soon. As I said earlier, actually it was this year that the state board appointed a student on its state board. I mean, that was, again, a tremendous move by our state board of education. And so, again, if you don't have a student advisory group, please start one and ensure that the collective voices are represented there. We are a locally controlled state. Your folks select your textbooks and so forth. Make sure that you have student representation and diversity on your textbook selection committee, on your curricular resources committee, to ensure that, and I know the state has done a pretty good job in going through to ensure to check for bias and things like that, but make sure that your local schools are doing the exact same thing. And I'm assuming that some of you do this as well. Those resources are vetted in the community first through your various parent groups, your parent advisory groups. And we also have taken some of our resources into the community, for example, and I know COVID presents certain problems right now, but into libraries. And we've had them out in the public, and we've asked for public comment as well. So again, if we really value that voice, let's continue to think of ways to get those students' voices heard.
Okay, thank you, Dr. Tucker. Moving on, I think there was a request for your email address, which I have provided to our superintendents, and I will be sending out a copy. The PowerPoint that was presented should be in your to the superintendents and those tuning in. That had an invite should be in your invitation, but I will also email that after the webcast is over with, along with a link to the survey that Dr. Woods Tucker was asking you to complete. Just a general, I guess we'll start at the top of the soapbox, which was our most popular question. What is being done to encourage counties to follow and promote the red zone recommendations when in the red? We really need local officials to also follow the guidelines and promote compliance in the community, not just in schools. And Dr. Glass, I thought maybe you could perhaps start with, we've really tried to do our part here at the Department of Education by sharing a video and a statement. If you want to go ahead and elaborate a little bit on that.
Sure. Well, I think Department of Public Health has done a nice job outlining and responding to a request for a numeric and color-coded recommendation that would apply for communities all across the state. But in state law, it does clearly give the authority for closing schools to the local school board. and that may be delegated to a superintendent or not. But when we see a community go in the red, it really should lead to a serious conversation at the local level with the school board, with the Department of Public Health around what is happening, where are the cases coming from, and then a prudent decision based on that information. So the Department of Public Health was clear that that color-coded sheet was not a mandate. They didn't run regulatory promulgate rules to make it a mandate, but it was put together after a request from superintendents in the state, and it's based on science and the prevalence of the virus in the community. So back to what I was talking about before, the greater the numbers of viral cases you have in the community, it puts all the more pressure on your school defense systems, your virus mitigation systems. So that's why those recommendations are what they are. So again, state law empowers you and your local school boards with the responsibility and the authority to make the decision on what is best for your community. And public health has put out this as guidance to help inform that decision.
All right, Dr. White, did you want to add anything to that, or?
Well, the governor and Dr. Stack and others have come up with what's called the Red County. It's something clever, and it just lost my mind. It's hard to get old. Sorry, Red County guidance or Red County recommendations, and it's just what Commissioner Glass said. This is not a school's problem. This is the whole community's problem, and so you do. Would expect a community, your mayors, your county judge executives, your Kiwanis Club, your League of Women Voters, everyone who has a stake in that community should be pulling together and saying, we got a problem here, and whatever we're doing isn't working. So what else can we do? How can we do something differently? The community the school deserves to be supported by the community. And I think the red zone recommendations, that's what it is. I knew it would come to me. Red County recommendations that are being showed every day at the press conference. And we can share those with the superintendents, is a guide that it's very reasonable for you to reach out to your mayors and your local authorities and say, we're willing to have a conversation. We'll share with you our Healthy at School guidance, and you can do this in your factories and your local businesses. They've asked at the press conference the last couple of days, how are we monitoring this? I don't really think there's a way to monitor this. You monitor it by seeing the number of cases not increasing and then starting to go down. But it is a team effort that everyone has to make. And I know we can do it. It's just getting that will to do it together.
Just a couple of things I would add to what Dr. White has said. In addition to state law giving the responsibility and the authority of closing schools when it comes to an epidemic to the local school board, who may have delegated it to the superintendent, the Department of Public Health and the local Department of Public Health can close buildings that they believe are reservoirs of disease. So far we haven't had that happen, but there's also a lot that may occur. We got that good news that Dr. Kavanaugh talked about the possibility of a vaccine coming forth, but it may be months before that has a practical or material impact on the virus in our community. And so no one can predict what's going to happen next week or next month, and certainly not 90 or 120 days from now, what kind of situation we may be in. So my recommendation is you've got to keep looking at the data, and no one should be digging in and making ideological or dogmatic decisions about this. This is going to continue and evolve and change, and so we're going to have to look at information and make decisions according to what the data is telling us. And I also know that there are some of you that are listening that would wish the state would just tell you what to do, and there's an equal number of you that would hate that. And so we follow the law. There aren't any kings and queens and dictators that are on these calls today. We're bound by what our responsibility is and also limited by our authority. And so again, the state statutes provide the authority for closing schools to the local school board, and we've got the information from public health on their recommendations on when to do that. If we see an explosion of the virus in schools and across community, we may be in a different situation, and different decisions will have to be made. But we'll have to keep learning, keep gathering information as the days go forward.
And I think just to piggyback off both of your comments, you know, I know during the call with the governor that we had just about 2 weeks ago, you all had asked for a statement from, you know, Commissioner Glass to kind of relay those comments that you could share with your communities. And so we did provide that. If you need to use that statement, or, you know, a suggestion is to, you know, make a statement to your community, and I know many of you have done that already. I've seen those, and I think those are all great ideas, that you know, reach out to your community yourself and explain the situation that's going on there. So the next question I have is that there is an alarming difference between local and state positive rates. They want to know if they are still supposed to follow the state map, even if it shows much lower than local.
Dr. Kavanaugh, do you want to do that one, or you want me to? I think they're talking.
Yeah, we can probably tag team that, but I would start just by saying there are always going to be a little bit of differences from the local and the state rate. The state, there may be differences in time of communication between our systems, and there's also some verification patterns that have to be done at the state. So there's always going to be a small difference between what we see locally and what we're going to see at the state level. Sometimes this has to do with the fact that an individual may move from one jurisdiction or have an address in one jurisdiction, like a college student, and that may be counted in that county, in that area, but then we find out that they're actually living in a different area. And so both counties may count them as a case, and the state obviously would only count that as one case, right? So sometimes we'll see discrepancies because they'll be counted in that local area, but the state will say, actually, they're in a different area, and we're not going to count this same one individual twice. They only get counted once. What we need to really be doing is use a uniformed approach, and I think the state level, you know, we're at orange and red in all of our counties right now. And I think in all of the counties, we do need to be following those guidelines. And if you're in a county that borders a red county, you need to take the precautions as well, knowing that that's where the state has been going. That's the direction that we've been seeing. So I think that's where I would say about where those discrepancies may be between that local and the state positivity, what we're reporting locally and what we're reporting in the state, has to do with some of those issues of communication, the timeliness of that communication between it, but also has to do with some of the aspects of what we're looking at state by comparing different local cases. But Dr. White, I know that you have more information on this. I'll let you.
Well, it's not, we're not looking at positivity rates by counties. We're looking at the rate of cases by county, by the number of cases per 100,000. So I may live in White County and work in Kavanaugh County and get a test done in Glass County. And so all three of those counties may count me. That would all go to the State Department for Health. We would see the duplication and deduplicate that. So your county may say, well, but Connie was positive, but I really am only positive in the county that I live in. So that verification, there is going to be a delay. So you are correct. Whatever your local health department director says, we'd had 5 cases today, and that may be what they know to be true. And once that's sent into our bigger database, we clarify and and certify, and that's where we get the numbers that we have. It has not been a huge difference most every time. You know, every once in a while you'll have a big outbreak. There may be a big difference. That's absolutely true. But there's going to be differences, and we feel very strongly that the data on the map is the closest thing to reality, and would ask everyone to use that as their baseline. So we're all using the same baseline that we make policy decisions from.
Okay. All right. The next question is, will there be any guidance given to schools to help us with contact tracing and knowing when to quarantine our own staff, since the health department will not be contacting people who need to be quarantined?
Well, no one said that the health department will not be contacting people. It is limited. If you are a health department and you get 4 positive cases, you call those 4 people, you get their contact information, you get their quarantine, the people that they have been in contact with, and then you call those people. That's a doable thing that a local health department can do in a 24-hour period of time. And I'm not picking on these 2 counties, but I just looked at yesterday. We had a bunch of cases in Jefferson, a bunch of cases in Fayette. The 3rd highest county ranking yesterday, Lee County had 94 positive cases. Bell County had 61 positive cases. That is an overwhelming number of people for them to contact, get their close contacts, and then contact those close contacts. So there are going to be times when the health department cannot do that in 24 hours. As I said last week, and I would encourage, if you're interested, to go back, and I know that's been recorded, but we had 4 different health departments that are already cooperating with each other, helping with quarantine and contact tracing. And so there are a multitude of different ways you can do that. The local health departments, I know with Dr. Stack, are working on some statements that if you are told you are a contact and you need to be in quarantine, we're going to have something very simple that says, do this, don't do this, don't do this. At least somebody can have something in their hand until they do get that phone call. So yes, if you're positive and you know you're positive, don't go to school, don't go to work waiting for the health department to call you. If you are positive, here's the piece of paper that says this was what you do. If you know you are a close contact of someone who's positive, don't go back to school and wait for somebody to tell you don't go to school. If you know you've been in close contact with a positive person, here's a piece of paper we can give you that tells you do this, don't do this, do this, don't do this. And that's going to be out relatively soon. But you can certainly work with your health department and say, okay, how can we assist you? Can we, I know one health department, the school nurse was doing it. One health department, it was somebody in HR. One health department, it was the district coordinator. And they were just getting phone numbers of all the contacts and just passing that immediately to the health department. So at least they didn't have to do that type of legwork. One case, they were interviewing the teacher at 4:30 in the afternoon on a Friday, and she went through everybody in her classroom, and then she says, oh, and by the way, Mary Lou is Joey's best friend. Now, Mary Lou wasn't in that same class. They would have missed Mary Lou altogether, but because of that conversation with that teacher, they quarantined Mary Lou, and Mary Lou in about 5 days was positive for COVID-19. So that's why the more we can communicate and figure out who these close contacts are, we can keep this virus out of your school system. You're muted,
Oops,
Tony.
muted, Tony.
Sorry about that. The next question I have is, Robin, are you, yes, you are still on. The next question is, I have a new food service director, and we are currently all virtual this week with NTI days. Can you remind me of the reimbursement guidelines for meals in NTI/virtual days?
So it depends. It depends under which program your district is operating under, whether you're under the National School Lunch or if you're on the summer feeding. If you want to reach out to me directly following the call, or you can contact the Division of School and Community Nutrition, and they can give you those reimbursement rates and how to operate. But it does depend on how you're operating right now.
Okay, will do. The next question is, has the Department for Health changed their guidance on taking student temperatures prior to arriving at school each day?
We at DPH meet weekly on with the team from Kentucky Department of Education every week at 10 o'clock on Thursdays. We discussed this just this last week. We felt like this was something that we still needed to keep in place. I know when I first go in and get my temperature checked, sometimes I don't meet 95. And so I have to get that retaken. But I think it is still important that we do these temperatures. I know we have caught some cases, not only of COVID-19, but we have caught some cases of flu. We've caught some cases of otitis media. So I do feel like in this committee group of leaders in both departments felt like it was still worthwhile for us to continue to do that at this time.
Okay. The next question I have is, I'm checking to see if Mr. Tackett is still, I'm going to skip over this question and see if he's still on with us. One question.
He's still here. I'm watching his box.
Oh, good. All right. Well, then I will go to the next question. I didn't see his box moving there for a moment. There he is. It's like you mentioned his name and he appears. What are Dr. White's thoughts on allowing a winter sports practice to begin when a county is in the red? And so I thought it would be helpful to have, obviously have Julie in here as well.
My thoughts are whatever Commissioner Tackett thinks.
Well, first of all, Tony, I am on here because I'm scared not to be with Dr. White because I'm scared of her like everybody else. They've been great partners since March, trust me. Remember that all the data has shown that in school together, we've not seen spread in athletics. It's really your call based on what's going on in your community. It gets back to something that both Dr. Glass, Dr. White, and everybody else said. The red county thing is a red flag for deep discussion. How necessary is it that you practice basketball? You know, we recommended early in the fall that we not have any practice in sports that were not in season. And yet that wasn't adhered to 100% either. So it's really just, it's a need for a very deep discussion and try to really address community gatherings and events. And it may be different from school system to school system. That's been our stance all along. We're providing an opportunity for those that can. If you can't, that's fine. We're trying to strike a balance here and let you make those local decisions. Dr. White, I didn't get too far out of line, did I?
No, just we know the more you gather, the higher that's going to increase risk. You can't not gather for the next year. So you use judgment and use professional judgment of how important is it to do this for this particular day in your particular county. Could you put it off to next week when maybe your county is orange? That's a decision that you have to make.
Okay. All right.
And the next, there's another part of that question, Tony, if you want me to go ahead, because
Sure.
It's really smart. It says, is there any additional guidance for how we should approach in-person school in the week or two following Thanksgiving break, given the likelihood of gathering and travel and increased risk of COVID spread? I wish I could remember which superintendent told me that she was, after her spring break, they were doing 2 weeks of NTI. They were just doing it that way. That way, nobody brought some far away COVID with them and spread it in the schools. They just did NTI for 2 weeks. I know UK, and I know y'all aren't collegiate, but they're doing some testing for their students before they go home, and they're wanting them to test when they come back. It just shows that we have to take this seriously. We're all so tired of this, but when we let our guard down, that's when someone gets sick. So I think assessing that is a really smart idea.
Okay. The next question, and this is kind of regarding COVID reporting. When will bus, garage, and Board of Education employees be added to the K-12 COVID reporting for schools? Bus drivers are the first contact many students have every day, and they are not reported on the school district's website that's on the state.
We are about this close to having a drop-down box called Other District Staff. And this will be where bus drivers, garage staff superintendents, central office. We will put a caveat that says that they may or may not have direct student contact, but we are working with our Oates office, just had some communication with them this afternoon and hope to have that within the next week or two. So I hope in December the 1st when we meet, this will be something that's up, and we want to run it past the KDE folks before we put it live to be sure that it looks smart to us, but we're looking through a different lens than you guys are to be sure that we do this correctly.
Okay. The next question is, can the Department for Health add the total number of tests administered each week for the entire state to the bar graph that shows statewide positive case numbers?
Well, we do have a total that we get of that, and it's something that I can bring the next time, and it shows not only the number of tests, but it shows you how many tests are positive, which is part of the way we get the positivity rate. So we have a graph that looks just like that. And Dr. Kavanaugh, is there any reason that that's a big top secret? And I don't think we can. I think we could probably share that.
No, I think we probably could share that. And what was the request for the number of tests performed for?
That can DPH add the total number of tests administered each week for the entire state to the bar graph that shows
The positivity rate
of case numbers.
Okay.
I think what they're getting at, Dr. Kavanaugh, is I've had this question asked repeatedly, is the reason we have more positives because we're doing more tests. And what we're seeing is that we are doing more tests, but not nearly to the increased degree that we're having positives. Right. So yes, we're doing more tests, but not at an exponential rate like the number of positive results. That's why the positivity rate is higher. More tests that are being done are positive compared to the number of tests that were being done before. So that I can give you that information, but it's going to show you that that's not why we're having more positive tests. We have more disease.
Okay. All right. The next question is the Department of Regulated Child Care is saying that teachers and assistants are permitted in child care centers to provide NTI. Is this safe? Can someone, I'm not sure, maybe.
So I'm not sure who the Department of Regulated Child Care is, and I'm not really sure what the question is asking. If they're asking if child care centers can have their teachers in there. I know that the state put out child care center guidelines back in June, and I believe those guidelines, Dr. White, are still in place. I think it's a reduced number of kids at the center. So if somebody wants to email me more specifics on that question, of course, our guidance for small group instruction is 14 students, 1 teacher for a limit of 2 hours. And there are specific reasons that you would come in: remediation, special education testing. So if you want, whoever sent that question in wants to send me an email, I'll be glad to try to help get a solid answer for you on that one. It's kelly.foster@education.ky.gov.
Thank you, Dr. Foster.
Those guidelines come from and I don't know if it was the department, it's not a department, but it's child care regulations, and that's in the Department for Community-Based Services, where the social workers live in the department, in the Cabinet for Health and Family Services. So it is coming from our cabinet, but I don't follow the question either. I'm sorry.
Okay.
Yeah, if you want to email me, I'll make sure we get connected to the right person at the cabinet and get you an answer.
Perfect. I will, and I'll put your email address into the box on that one as well. The next question that we have is, we were told by our health department that they will not be contacting contacts of positive patients, and that they are leaving it up to the COVID positive person to contact their people. Is this correct?
Dr. Kavanaugh? I'm sure that happens at certain times, but I would like Dr. Foster, if I can get a specific, I can follow up on that. Dr. Kavanaugh, are you familiar with that?
I'm not familiar with that. If we could get information on that, we could follow up. I would say that it may be something with the case numbers right now, that they're trying to get to that all of the immediate cases as soon as they can. And in the meantime, they're saying, please call everyone else because we need to call the next infected individual. So we get everyone accounted for, but please let us know where that's happening just so we know that information as well and can follow up and get an answer to you.
Dr. White and Dr. Kavanaugh, you may not have had time to see this today, but I have heard reports from superintendents about local public health departments indicating that they don't have the staffing or resources to continue the contact tracing at the volume of the virus that we're seeing. And so they're communicating with our school districts that they're going to stop or limit that. So that's, I think we need to follow up and find out where that's happening and what conditions are leading to that, and talk more about that. So you may not have had time to see that message I sent you earlier today, but it's an issue that's popping up.
Yes, I saw that. And I think Dr. Kavanaugh is correct. Like I said, Bell County got 61 cases. You'd have to have, if you have 4 contact tracer for every 4 people. I can't do that math real fast in my head, but you'd have to have 20 people doing contact tracing in Bell County, and that just isn't going to happen. And it's not like you can get from other counties to come and help because the next county over also had 20 some. It is such a widespread issue. So there are going to be times when they're going to call Jason Glass and say, you're positive, and everybody that's a close contact, call them right now. We'll give you the information you can give them, but we need to go and we got to call. Well, they're not going to say your name, but we got to call Allison Kavanaugh because she's a positive case. So we want to get all the positive cases called first. By the time you get to contacting the contacts, it's going to be 3 or 4 days later. And that's assuming they don't get any new cases tomorrow. So they're trying to put their emphasis on the positive patient, and they're saying, can you please help us? Everybody in your household needs to quarantine. Everybody that you had lunch with yesterday needs to quarantine. Go ahead and contact those people. We will try to catch up with that, and try to get as many people seen, but to get the people with the infection first and then get assistance from those people to help out. That is the only way, because like I said, we've hired 800 to 900 new people in the state of Kentucky to do this. And that worked until, what would you say, Dr. Kavanaugh, probably about 3 weeks ago. Our ratio was still good, number of contact tracers, number of cases, and it's just gotten blown out of the water in the last couple of weeks.
That is part of why counties go into that red, because when we go into that red, we know that this is going to really tax our local health departments. And that is why we say, please reduce as much exposure and contact if you're in a red county, because we know that this is going this is going to really tax the current tools that we have in our toolkit.
Okay. All right. The next question I have here is, what is the expected turnaround time for a health department in the county where someone tested to share that result with the health department in the county of residence? And then there was an added comment in there saying, hold on one second, I have to pull up that one. Just saying that they're seeing that this notification window is starting to take longer.
Well, for example, if I go in and get my lab work done and they take my address, then they're going to contact that county. Well, it may turn out that I work at that address, but I live in another county. So first, if the laboratory doesn't get the address correctly, they're going to notify the wrong county. Then that county is going to figure out I don't live in that county, and they're going to let another county know. Or sometimes the laboratory doesn't even give us the address, they just give us the date of birth. Sometimes the laboratory will say, oh, we haven't sent y'all any results for the last 5 days. Here's 200 cases. Now, they're all not positives. We've got systems in place now that if we don't hear from a laboratory in a couple of days, we're starting to contact them and say, hey, you don't have a backlog, do you? We can't deal with backlogs. We need this current. So we're finding where the problems are, and we are finding every day we find something that we need to try to build a guardrail in to make sure that it doesn't delay that case reporting. And that's one of the big things that Dr. Kavanaugh is involved with. She does the numbers. I'm an OB doctor. I only deal with 2 is the highest amount of people that I am used to dealing with in my life, mom and baby. So that's her bailiwick. But there are just, you can't imagine the what different ways that this can be delayed.
Okay. All right. The next question, Dr. White, they're just wanting to know if you can address using the touchless thermometers to take temperatures on the forehead versus taking them. Oh, she's on a call. Sorry. Let me go to the
Maybe
next.
Dr. Kavanaugh can help us
Or
with
maybe
that.
Dr. Kavanaugh, or taking the temperatures on the wrist. Or should we wait for Dr. Wright?
I think go ahead, Dr. White.
They had my uncle's being discharged from the hospital, and that was him calling. So I wouldn't have taken a call for any other reason than that. So
okay, sorry about that.
Thermometer, taking temperatures on the wrist. I've been reading about that. You know, I went to the hospital to visit someone, and they did a carotid. I've seen it done on the wrist. Do you have any data on that, Dr. Kavanaugh? I've tried to find information, and I couldn't find anything that I felt real strongly pro or con. It appears to be a acceptable technique, and I can't really answer that with any authority myself.
I agree. I don't know that at this time I've had enough read evidence that would either support or say that it's a lesser technique, but we can look into that.
Okay. All right. The next question comes from the Google form, saying that the 7-day incident map, they would like to see it to be a little bit more up to date. They're saying that their health department, there's a 4 to 7 day delay from local numbers, the same issue with the local numbers. So they're just wondering, you know, it's hard for them to justify with the public using the map when the actual numbers are not matching up for 4 to 7 days. I didn't know if there's any solution for that.
I guess I would say it depends on what you want to call the actual numbers. Go ahead, Dr. Kavanaugh.
And I would say there's slight differences and date of how these are calculated based on the date that they were tested versus the date that we determine them to be a case. The other thing is for the state, if these are old data, sometimes we get information that someone's just documented as a case today and it's shared today, but they were actually tested and were infectious back in June or July. We won't include that on our incidence map because that's not what the spread is currently. So there may be some slight differences in the calculation of what's being shown on the local health department versus what's being shown at the state for many reasons like that. But we can be pretty confident that what we're showing at the state is the number of new cases that were identified in the last 7 days that have been recently tested or recently developed the illness.
Okay. All right, I'm just adding an additional comment in there for the Google form, just to back up on that, just so you all have that. The next question that they posted in the Google form is just wanting to know if there is, if there's any evidence that holding in-person instruction where students are 6 feet apart and masks leads to COVID outbreaks in schools. Or have we seen that in other districts or in other states? If there's anything about that, if there's any evidence of that.
Dr. Glass, to my knowledge, we have not seen outbreaks in schools. Dr. Kavanaugh, I mean, because you are spacing the students and faculty and wearing masks. So it appears that these mitigation techniques and all of the other things that you're doing are working well. And there are other states that aren't doing these mitigations techniques, and we've seen those numbers go up.
And what, just to build on that, that's consistent with what we've seen internationally as well. We had systems around the world that came back with in-person learning in the spring and over the summer, either because the virus hit there earlier or they were Southern Hemisphere countries that were on a different calendar cycle than we're on. And those places that had layers of virus mitigation strategies in place, similar to what is described in the Healthy at Schools guidance document, were able to control outbreaks. We did see some notable lapses in that, and they came in those places where people got fatigued from the virus. It became a political issue. So Israel is a notable example of a country where there was a lack of consistent guidance. There was pushback around the severity or how seriously the country should take the virus. And the weather got hot and people got tired of putting up with all the virus mitigation strategies. And then they had large-scale outbreaks at school. So that serves, I think, as the world's cautionary tale for that you have to keep your guard up. And even though we're tired and we're fatigued and there's all kinds of opinions about this, the virus doesn't care that you're tired. The virus doesn't care what your opinion is on it. It is seeking an opportunity to spread, reproduce, and make people sick. And so we just, I think, have to keep our guard up through this.
The last question, because looks like we have about 4 minutes left, and I think that we've answered all of the questions. And Robin did answer this in the soapbox, but I just want to make sure in case you're not sure how to check those. This was a budget question about the life insurance or administration fee that were not originally exempted for the budget reduction and were KTRS contributions exempt. And Robin, if you want to provide a response,
Yeah, just a quick clarification. So any funds that have been appropriated to the Kentucky Department of Education on behalf of the department itself or local school districts, none of those funds are subject to any budget reduction at this time. So anything in our total appropriations that are allotted to us from the General Assembly, there are no reductions at this time.
Okay, great. So with that, I think we are done with the question and answer, and I will kick it back to Dr. Glass, and hopefully Dr. Woods Tucker is not getting blown up on his cell phone, and he's still with us.
Yeah, thanks, Tony. Thank you, Dr. White, Dr. Kavanaugh, for being with us and answering all those questions. Thanks for your presentations, Robin and Thomas as well. And I think we're going, Department of Public Health has already replaced their call-in number with Dr. Woods Tucker's cell phone number, so he'll get plenty more calls coming forward here now. Thanks, everybody, for being with us, and thanks also to Julian for jumping in and answering the question, and for Kelly jumping in and answering questions as well. We hope this has been informative to you. We appreciate the time with you and appreciate your questions and all that you do on behalf of kids in the state. And you don't hear it enough, but please hear it from us. Thank you, thank you, thank you for all that you're doing. Take care, everybody.